Check for an answer. Shake gently, asking, "Are you okay?" If the person does not respond, open the airway and check for breathing. If they are breathing normally, place them in the recovery position. Call 112. Keep monitoring their breathing. If they are gasping or not breathing, call 112. Go and search for an AED machine. Immediately begin CPR. Place your hands in the center of the chest. Push hard and fast, at least 5 centimeters deep and at a rate of at least 100 times per minute. Seal your lips over the mouth. Insufflate firmly until the chest rises. Blow again when the chest falls. Continue performing CPR. Connect the AED and pad placement. Follow verbal instructions immediately. Place one pad firmly to patient's bare skin, below the left armpit. Place the other pad below the right collarbone to the side of the sternum. In case there is more than one rescuer, do not interrupt the CPR. Keep the place clear and manage the shock. No one should touch the patient during the analysis or during the shock. If the victim begins to wake up, does he move, opens his eyes, breathes normally, please stop CPR. If the patient remains unconscious, roll them in the recovery position. Monitor the patient and wait for emergency medical services to arrive.